Good evening and welcome to our new episode of Visit. And I am delighted that you are back, and I would like to thank you very much for all of your valuable correspondence, from which I've chosen something again today in order to give you some peace of mind. And above all, to tell you what is necessary now at the beginning when you are faced with a diagnosis that will pull the rug out from under you. And I personally am a subscriber to Nature and Healing. Now, I don't want you to feel at all that I'm promoting this magazine, but this is a really wonderful magazine that has accompanied me for well over 20 years and depicts topics of medicine and naturopathy in a very nice way, again and again. And I found a very interesting sentence, and I would like to quote it before the next case. My way. We should never try to follow someone else's way, for it is their way and not ours. If you only found your way, then you don't really need to do anything else than to sit back and let the tidal wave carry you to liberation. If you found it, never move away from it. Your way is always the best for you, but it's not necessarily best for someone else. I have now read this sentence to you because I got an email from a daughter who realised with unbelievable worry, and also, I think, pretty headless, that the mother had breast cancer. So it must have happened quite suddenly. And while, of course, she asks for a second opinion, I ask for your understanding that, of course, some time has passed between this request and now, but maybe it is still a current topic after all. Cancer is not an emergency at all, never. Cancer is a situation that still burdens us today as much as it did ages ago. And I've been looking for another word for many years. We are desperately looking for solutions, for vaccinations, for any medication that would be even better, instead of really taking medical care to prevent it. That would mean a huge task for medicine in the next few years. Rather than developing even better anti-cancer drugs, because it is a disease that has actually already gone through a long process. And it's a disease that can also be found in one's own life. And it's a disease, especially women's breast cancer, that must have had very conflict-ridden issues in the past. And that's why it's so important to try to perceive and also to recognise all of these things at the beginning. If you now do everything headless, full of fear and worry, and with the severity of the diagnosis, blindly, and I mean everything, and we have been doing that for 70 years, OP, chemotherapy, and or irradiation, it depends, then the fear of it is actually still as it ever was. And I think we should also carry people medically now, and we should enlighten them. And we should take our time now to take a very close look at what actually happened here. Cell degeneration occurs. There is a new cell formation, so we know today that a tumour cell has a completely different metabolism than a healthy cell, and also nourishes itself differently. Warburg informed us of this as early as 1938. The tumour cell metabolizes 20 times more sugar. It's important that you know this, and not unconsciously right now live ignorant and substitute carbohydrates and sugars without end. By that I also mean the carbohydrates like rice and potatoes, and enough and lots of fruit and so on, sweets. That is something that is very important. On the other hand, it is now necessary to take a look. What is my immunity level like? Have I been virally contaminated for many years and don't even know? And am I toxically contaminated and don't even know? How is my parasitic situation? We also know today that parasites and the development of tumour diseases is a very big topic. You should all know that, please. And what is very important is when an operation is necessary, and that is guaranteed, because it is about tumour relief, then a great work is required afterwards to look at me as a person. It is my tumour. It was possible in my body. There are hundreds of thousands of protective mechanisms in our body that ensure that a cell, that is, I was just about to say in a so-called mutative state, but which has to go into a different metabolic path, that often a normal cell death turns itself on, which also protects the cell and the body from the continued life of this cell. Which mechanisms don't work? That the body can't initiate this protection program. One of the most important controllers is vitamin D. Vitamin D activates the natural killer cells, and they have the duty to give the signal for such protection programs immediately. A tumour disease is now very quickly put into a fair way, which of course also deals with the patient's worry. And I don't want to deny that to anyone. But one is so unsteady and so bottomless that one naturally thinks, I have to take radical action against this tumour. I have got to get chemotherapy beforehand if there is still a tumour cell somewhere in my body. In any case, if the breast has not been removed, only the tumour, I have to undergo irradiation. These are all things that can be like that, and I don't want to question them either. But I would like, and that is what I wanted to tell you at the beginning through this text, it is important that you now know what you want, and doctors can recommend you. But from the bottom of your heart, you have to find your own way. And if, let's say, they sometimes talk about a very aggressive or less aggressive tumour, a tumour disease always has a lower chance when the body can find its way back to its strength, because your body has already shown you more than 30 or 40 or maybe 50 years that it could handle any kind of developing tumour cells wonderfully. But something must have happened that your immunity, that this defence has become weak. And it is very important that you ask yourself these questions so that you can now take control of your life yourself, that you put down your arms first, who are now burdening you with therapy aimed at annihilation. A surgery is not annihilation. A surgery is relief. But an irradiation is an irradiation of the blood. Chemotherapy is an attack against the body. not the tumour cells. And it doesn't make sense to make a statement about the activity and about the situation of the immune system after chemotherapy. Every oncologist knows the risk involved in chemotherapy. And it's a completely different situation when a tumour is very far advanced. And maybe agree to chemotherapy to possibly sustain life. But there is no justification for chemotherapy of any kind. And I sometimes read that on reports when the patient's need for security is high. We can still do it post-operatively, or the guidelines say that chemotherapy should be used here, if there is no reason at all. And the PET scan shows that everything is free and in order. We are on time, we operate on the tumour. Then it is a wonderful and good starting point to now set up a broad-based health concept for the body. And it has to contain everything. It has to contain regaining peace of mind. Because an adrenal insufficiency, that is when the adrenal glands have become weak from stress and the strain of life, if there is a lack of adrenaline, a tumour can trigger itself. It is therefore very important to perceive what has actually stolen my life force from me in the last weeks, months, and even years. What happened? With what sadness have I lived since then? What fears have I been living with since then? This is very important now, because now I have to turn inside myself and decide. I choose life. And then I have to accept the past, but I am no longer allowed to address it for the next 20 years. I have to come to terms with it. I have to try to let go. And above all, I have to find rituals to slowly come to a new peace with myself. What is completely unproductive is now to be afraid, because maybe know this and this and that. Difficult course of cancer, and because you may be afraid of the future. But that is by no means decided at this point, with this diagnosis alone. And I ask you to find your way back into peace. And now, of course, to look for partners who look at you. I don't think the diagnosis is important. For me, the name of the patient is the diagnosis. And now you have to look at the body. You have to recognise its physical and mental balance or imbalance, and you have to look at life. You can't afford to sit on your cell phone for 8 hours now. These are fire accelerators that interfere with the immune system. We made experiments in the clinic. Blood was taken and looked at in the microscope, a dark field microscopy, and at the same time we sent the blood to Berlin to see how the white blood cells are doing. Then we irradiated the blood for 1 hour with Wi-Fi in a special room. I was really deeply shocked that after this Wi-Fi irradiation, the blood under the microscope showed absolute leukocyte rigidity. Do you know what that means? That my white blood cells have lost their activity in dealing with viruses, with bacteria, with life. And the blood that then went to Berlin confirmed that significantly, a clear statement that the white blood cells got too much oxidative stress, that they lose their ability of phagocytosis, as it's called. None of this is immediately visible, but that is what may burden the body for years. The large radio antenna that may have been set up in close proximity to you, and you exactly live in the skyscraper or wherever, an invisible danger. Get rid of all these things as best you can, and bring someone into your apartment too, who can perhaps measure this for you. There are really so-called tumour sleeping berths that have an unfavourable constellation, because power lines are not properly closed, and because you lie exactly in this field, which no longer allows you a healthy regulation of your body and weakens you on a completely different level. Tell your mum that in this situation now, and now a little but not much time has passed, that a meadow out there will turn green again. And it gets pretty much damaged sometimes. When it's autumn and winter, you can't see anything of it. But it is the same in us humans. For 24 hours, life always tends in one direction. And that means getting healthy, keeping balance, finding strength again. Please take your time now and look for people who understand and accompany you in the same way. I mean accompanying you in whatever you decide, as it will be your good path. There is no black and white thinking. People take on board now whom you trust, but also feel which way you want to go. And this path must be accompanied by people who are not interested in treating breast cancer according to the guidelines. According to the classification, it must be done in this way. But you are you, and it will be integrated into all decisions. What is important to you? And then please bring my colleagues on board too, who also know today from a lot of experience that it may be more difficult sometimes, but it is more honest to go new ways for yourself, to make decisions that you never wanted or could make, in order to ultimately lead the body back to health. And not only to be breast tumour free at the moment, but in the context of this disease, to put your life on other, healthier, stronger feet, so that you can say in 10 or 20 years, I once had it, but that I changed my life a lot. And today I'm grateful that I look back on that time, and I wish you the strength to do so. And you won't be the only one taking this path that has lived through this growth in a very positive way despite difficult times. In this sense, I wish you all a wonderful evening and look forward to next Sunday next week. Thank you.